Welcome back to the Cash Practice Solution, where we focus on your quality practice and making sure you get properly compensated for the work you do. I'm your host, Dr. J, and today we're discussing a pivotal aspect of practice management, defining your ideal patient. This is critical for creating the meaningful connections you need to drive your practice's success. So in the business world, just so you'll have this point of reference, the ideal patient is called an ICP. They're the ideal client profile. So let's paint a picture of the practice guaranteed to struggle. This is me in the beginning of my career. I just finished internship training, and the training hospital asked me to help them get a satellite clinic started in a neighborhood nearby. So I enthusiastically embraced their consultants because what did I know? I didn't know anything. So I opened my first practice full of optimism, and I'm going to take on everybody and I'll serve anyone who walks through the door. And at first, I thought their more patients equals success mindset was right. But it didn't take long for reality to set in. I felt like I was moonlighting in somebody else's urgent care. And I had moonlighted, and it felt just like that. And it was my practice. We got busy, but getting tired of generic interactions with patients who were not invested in any of the things that I wanted to provide didn't take long. Most of them wanted the quick and dirty, like a prescription, and that's it. And I wanted to be more involved in their care and really provide some things that they couldn't get necessarily somewhere else and have a relationship. I never thought, what would an ideal patient look like, especially during training, because you don't have patient relationships in training. You're basically rolling through. When I stepped out into the hospital-sponsored satellite clinic, the whole thing was oriented toward feeding patients into the hospital. And by the way, if you're thinking about being an employed doctor, that's what employed practice is like. You're feeding the hospital. It's all about numbers and volume. And without a clear definition for me of an ideal patient, I ended up seeing all sorts of people with all kinds of expectations, and too many of them weren't right for my style of practice. And I knew in this at that point, and I'm just beginning to develop it, but it happened really fast. It was within months. So it consumed so much time and energy, and I didn't get the kind of outcomes I was looking for. I wanted people who were getting stronger and healthier and better, not just running through prescriptions. So the strong doctor-patient relationships were my ultimate goal. And I only knew how to build them with communication. And I didn't have the time, and the consultants were just running people through. So I had to start to look to engage patients who were interested in the same kind of thing. What's really crazy is that if you look at the literature and data from management studies, they show that solid doctor-patient relationship makes patient retention increase by 30%, and patients who feel connected, like, I love my doctor, they are 500% more likely to come back for future care. So the ready-med and urgent care kind of environment, I think it's great. We use them on weekends and stuff when the practice isn't able to handle patients. They're great to have, but it's nothing like what a deep and meaningful doctor-patient relationship can create. So everything began to change when I finally committed to identifying my ideal patient profile, which was revolutionary. I started attracting patients who resonated with my philosophy, and they really wanted to engage in their care. The impact of having ideal patients is absolutely profound. Not only do they remain loyal, but they also refer other patients who are kind of like them, similar values and needs, fitness people, health-oriented people, people who want to go low on meds and do more natural stuff, which is more my groove. In our practice, we can trace a huge percentage of our patients to just about maybe half a dozen what I call super referrers. I would say half of our patients are through those half dozen people. So it's amazing, and we take really good care of them, and we make sure that they know it. Research shows that referred patients stay with the practice and have a much higher lifetime value in terms of total income revenue, way more than the non-referred patient. It's at least 25%. And it's probably way higher. And traditional marketing doesn't bring that in. And we did spend a bunch of money on that at one point, but it created very little benefit. But once you start getting patients to refer, your own patients to refer other patients like them, it's a snowball effect. And the quality of your practice brings more and more and more of the same. So let's talk about how to select your ideal patient based on specific characteristics. So here are some key traits to consider. You want to look for values being aligned. So you look for patients who share your values and approach to healthcare. So meaning, do they really want to have just a quick stop, fill their prescriptions and move on? There's nothing wrong with that, but that's definitely not coherent with my values. When you have that kind of quick move, you're not able to develop communication, and you can't create cooperative treatment plans. You can't have shared decision making. None of that works. Next, you want motivation level. You want to find patients they're proactive. They don't have to work out every day, but they have to be willing to consider it. I call it vitamin X, and I really want to coach patients to get into exercise, vitamin X. And they need to take some responsibility for their care. I don't need them to be perfect, but I want them to be willing to have the conversation. And most patients, if you coach them enough, they're going to get there. They're going to start to engage in some activity. Demographically, you want to consider patient's age. Our patient age really is very clear to us. Between 30 years old and 70 years old, that's kind of the sweet spot. Some people need to consider location. We see patients from all over the country, so it's not quite as important to us, but location can really matter. And lifestyle factors. So people who are Cheetos and Dr. Pepper for meals, that's not a good demographic for most people who are into a fitness practice. So make sure that you understand kind of the demographic you're looking for. Fit people who are at a certain age group from a certain area can really help. Treatment history. This is huge. One of the things with our technology that's really good is when we do symptom assessments, we also do history assessment. And so a patient who has a history of really doing kind of what the doctor ordered and having positive outcomes is almost sure to have the same relationship with you. They'll do what you say, and they'll generally do well. And this is like the warning, Will Robinson. Patients who complain about a previous doctor, that Dr. Smith, he was no good, and the one before him was even worse. You're next. They're terrible. That's a horrible treatment history. If you hear that from a patient, don't plan on rescuing him. I mean, if you want to, you can go ahead, but my experience has been that's a loser. So patient history is really important, their treatment history, their communication style. Lots of patients are, you'll walk into the room for their first visit and man, they just connect. And they're open and you can get that done really quickly. They ask questions, you can provide feedback and it works. Collaboration, it's talked about a lot, the idea of a shared decision-making. Not every patient really wants to do that. We hear a lot, you're the doctor, what do you think? And I can tell them, and then I engage them. And we use technology as well that it's better than a portal. A portal's good, but an open note system is where every bit of data is available to the patient. And all the lab work and every visit and every phone call and every message and everything. Patients who like that, they're our ideal patients. They want to know what's going on. We want them to know what's going on. And what you find, or what we find, is that you get a whole lot less phone calls. You get a whole lot less, I can't remember the last time we had a late night phone call from a patient. And we have a couple thousand patients and we don't get them. And then it's a little self-serving, but I'm allowed to be a little self-serving because we're taking really good care of patients. You want to think about their referral potential. People who have networks of friends, they belong to a community group, whether it's theater or art or music or church or whatever, people like that are super valuable to your practice, and they're likely to refer like-minded people from their social network. And we have a practice in our practice, and I do this, I would say at least 50% of the time, and I hope a lot more than that. I thank patients for coming in and seeing me. I say, thank you for coming to see me today. And then I say to these ideal patients who are really just like sweet spot, if you have any friends who you think would really benefit from what we're doing, I'd love to see people just like you because you're awesome. And I mean it. I'm not making it up. I love my patients. And when you invite them to send their friends who are just like them, they do. The whole point is to recognize that patient loyalty stems from trust and a real connection. Sometimes that takes more time than in a quick, urgent care kind of situation. But when patients feel understood and valued, the chance of them returning is dramatically higher. And once I understood kind of what I was looking for in an ideal patient, I stopped marketing to the public generally and moved in a completely fresh direction. I could stop experimenting with, a magazine or a flyer or, all the things that don't work, and begin attracting patients who aligned with my values and were willing to invest in quality care. That means like a cash practice, right? They know that insurance is not going to provide them the highest quality care. In primary care, cash is king. It's the only thing that works. But that's kind of the rubric for how do we find an ideal client? Why is it valuable? How does that work? So thanks for joining me today on the Cash Practice Solution podcast. Don't forget to check out our Cash Practice scorecard at cashpracticesolution.com. It'll help you guide your decisions and really do a really, really good job of making that transition. If you found this episode to be helpful and hopeful, please share it with your colleagues who could benefit from it. Until next time, remember the keys to your success. Apply to the ideal patient too. Listen to your patients. Learn their stories and love them with your whole heart. And it's true, you will be unstoppable.
Thanks for joining us. And if you have enjoyed today's conversation, be sure to hit subscribe so you don't miss out on future episodes packed with insights to help your cash-based practice thrive. And don't forget to check out all the tools and resources available at cashpracticesolution.com. They're free to you, and we're always adding more. Keep raising the bar in patient care. We'll reconnect in the next episode with more ways to help you succeed.